Okay, and doctors, we actually have a list here of some of the symptoms that do occur when talking about uterine fibroids. So could you maybe walk us through some of these and again what you might hear from some of the patients that you actually have dealt with?
Sure. Between Jim and myself, we've seen a bunch of different patients, and there's a bunch of different symptoms that occur. One of the most common is what we call metrorrhagia, in which is heavy menstrual bleeding. That could be large blood clots. It could cause anemia if severe. And so the bleeding is one of the biggest symptoms, but then there's also the bulk symptoms, which is pain or pressure in the pelvis, which can cause frequent urination or constipation. You could have pain or bleeding after intercourse. Fibroids can lead to infertility or miscarriage. You can have an abnormally enlarged abdomen. Some of these women actually look like they're pregnant. As a matter of fact, during the physical examination, we talk about weeks gestation in the abdomen size when we palpate and feel how high we could feel the uterus in relation to the umbilicus or the belly button. Also, bladder pressure could lead to a frequent, a constant urge to urinate and even urge incontinence in some patients.
And one very important thing to remember is that the fibroids are present for a long time, so the symptoms develop gradually. And what a lot of women don't really realize is that their quality of life changes, and they're not even aware of how impaired they are because it happens over a long period of time. So when we're done with treatments, many women come back and they say they feel much better about many facets of their life, not just the bleeding, not just painful intercourse, but all types of things. And what has happened is they don't realize that over years and years they've had this slow decline in their function. So once we treat them, there's usually a huge change in quality of life.